Well, let's get reaction to that particular healthcare inquiry. And we speak now to the Board of Healthcare Funders System Strengthening Head, Dr. Rajesh Patel, who talks to us from the Alberton area this evening here in Gauteng. Dr. Patel, good evening to you, and thank you very much for your time. Let's talk about your reaction first to what the Health Minister, including his counterpart from industry and competition, and that is that private healthcare in South Africa essentially has become unaffordable for many South Africans. Does that sit well with the Board of Healthcare Funders?
Good evening to you, and good evening to you. Good evening to the viewers. I think there's two ways to look at what is announced today. The bottom line is the cost of healthcare in the private sector has been out of control for more than 2 or 3 decades. So the fact that there's recognition right now that something needs to be done about it, I think that's a positive step forward. What we need to do and keep the government accountable for is actually the implementation of these recommendations that they're putting forward.
All right. So if this has been a clear sign for over 10 years now, what role would the Board of Healthcare Funders play in trying to reverse this?
I think for long we've been actually advocating for the various interventions that are required to make healthcare affordable, to strengthen the health system, not just in the private sector, but also in the public sector. I think before this interview, there was comment about how licensing should be done, how information should be collected. Even those components, we've been making contributions in that regard. Obviously, the BHF represents a number of medical schemes, so it's in our interest to make sure that the health system operates in a way that makes healthcare affordable. One of the important things is the constitutional mandate. We talk about the Section 27 of the Bill of Rights. It actually states along the lines of access to healthcare services, and the byline there says, to the extent affordable. Now, this became law in 1996, which means everything we were doing from that time till now, we should have asked the question, does this lead to improvement in access to healthcare service? Does this lead to improvement of affordability? And I think BHF has taken that clause and even that Section 28 quite seriously. And we've fully contributed to every intervention or every request for comment. And even when comments weren't requested, if we felt something needed to be intervened on, we've actually put those recommendations forward.
Yeah. There is a very striking line here, Dr. Patel, which talks to exactly what the problems could be that face patients right now. And this is a line from the Competition Commission who say, and I quote, "You don't expect a patient to go to their doctor sick and start saying, I'm negotiating fees." And they go further to say, given the obvious power and knowledge imbalance, a gap between a patient and his doctor clearly exists. And
Yes.
You've got to talk to that, because parents have been at the receiving end.
I'm actually happy to talk to that, because that's been part of the problem with the Competition Commission up till now. They've seen healthcare services as a commodity and therefore subject to competition law and competition theory. The reality is in South Africa, because we've got that Section 27 that talks about access to healthcare service to the extent affordability, healthcare service like access to milk and bread, etc., has to be seen as an essential service that's not a commodity. And therefore, you can't talk about the theories that work for commodities to apply to healthcare scenario or to the price of bread and milk, etc., to anything that's an essential, even access to water, electricity, etc. So critically is we have to take the obligation to make sure that those of us who are in the know about what needs to be done actually take a step forward and make healthcare affordable. It's just been unfortunate that for 2.5 decades, the regulatory environment really wasn't interested in making sure that the reforms that are required in the healthcare environment were actually taken up and implemented. And as I said, the fact that they're actually stepping up at this point in time, they need to be commended, but we need to take the steps forward and to make sure with regards to that, the block exemption, we make inputs in that processes. The minister has talked about many interventions that they want to put in place, And we need to make sure that we keep them challenged and hold them accountable to implement. There's some things he can do by tomorrow. He can call Council for Medical Schemes tomorrow and tell them to fix their interpretation of Regulation 8 of the Medical Schemes Act. Their interpretation was prescribed minimum benefits must be paid at cost.
Yeah.
And there's no such a thing as creating unfunded liability. You cannot apply that pay at cost while the Constitution says to the extent affordable.
Yeah.
So that's a quick solution that can be implemented tomorrow.
Yeah. Final question, and very briefly, if you can, Dr. Patel. Your language seems not too distant from that of the government authorities. Can I ask you this simple question? Does the Board of Healthcare Funders support the continued existence of private healthcare schemes, or might you advocate for their shutdown?
No, definitely. You can't destroy the assets that you have in the country for something totally new. So to the extent that you have medical schemes where you can introduce some reforms and strengthen it, you shouldn't be getting rid of them at this point in time. Not the medical schemes, not the infrastructure that goes in supporting it, and not obviously for the 9 million lives that are on medical schemes. The private sector, the service provision sector needs reforms, needs legislation. We need to make sure we implement that. Let's strengthen it, and let's find a system that literally builds on what we have right now, both in public and in private sector.
Dr. Rajesh Patel, thank you very much for your time. He is the head of the Board of Healthcare Funders, specifically the System Strengthening Head.